Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today, folks, I'm gonna take you with an inside perspective of what the first week after a facelift is all about, what it looks like, what it feels like, what people are going through. I think it's gonna be very, very insightful for you to see this. Very interesting, obviously, but also if you're considering having this done, it'll give you a perspective of what to expect and what it will be like, so that way you're not surprised. In my opinion, expectation is everything, awareness is everything, because sometimes if you're blindsided by something like this because you're used to just seeing a before and then an after and you don't know what happens in between, it could be a very, very rough and sticky period of time. And believe me when I say this, because we do literally nothing surgically but these type of procedures. And just to be clear, I'm gonna refer to my facelift as a vertical restore. It's something slightly different than a standard facelift in the sense that it's a combination of 4 different procedures blocked up into one. It's a lifting of the lateral brow, mid-face, jawline, and neck. It's a deep plane approach. So the things that I'm speaking of here are related to my trademarked vertical restore procedure, but it's also applicable to any type of facelift you will have done anywhere, because I used to do a different style of facelift and I know all about the different styles of facelift. So the things that I'm going to be describing on a day-to-day basis post-operatively really apply to any technique that you undergo. But just know that I'm going to be, out of comfort of my own tongue and habit, going to be referring to it sometimes as vertical restore, and I don't want you to get confused by that. All right, folks, so here's the story. So when you want to undergo a facelift, what you're doing is you're trying to address the jawline, the neck, and these type of areas. So you're going to probably go through and meet a lot of different surgeons and study a lot of different surgical outcomes, and then finally decide, what, this is the person I want to get it done with. And once you establish that, most important thing I can tell you right up front, the most important thing is, I need you to realize that you're going to go through something pretty jarring, in the sense that anytime you mess with your appearance and distort the appearance, you're going to end up feeling very stressed by it. So it's extremely, extremely important that you have full trust and awareness of what you're getting into, but full trust in the surgeon and their surgical team, because when you're going through it, you need to rely on that trust to help you through. And I cannot stress that enough. I'm telling you this, it's probably one of the most important things. So if you have any doubts going into surgery, as you're going through the healing process, those doubts are going to be amplified. And you're going to get stressed and anxious, and it's going to be a long healing process for you. But if you choose wisely, pick the right surgeon, make sure that you feel comfortable with their team and their approach and everything else, and they prepare you properly, that will go miles and miles in terms of helping you, just float and navigate through the process, have your ups and downs, but then also always having faith that the process will be the process that will lead you to the results you're looking for. All right, so without further ado, let's break it down. All right, so you have a procedure. Now, in our practice, the vertical restore is performed under IV sedation with local anesthesia. So our immediate surgery aspect is going to be a little bit different. If you're having general anesthesia, you're going to probably be in a recovery room right out of surgery for an hour, 2 or 3 until you kind of come to, and then you're going to go home. With vertical restore or any other procedure that's done under IV sedation, at that point, there is no major recovery. You literally just leave the surgery suite, go home, either to a recovery center if you need one. Our patients, and most patients, generally speaking, will go either to their home or to a hotel if they're traveling, etc., and begin the recovery process. So as you can see, when a patient leaves, typically you're going to be wrapped up. You're going to be wrapped up, and we joke about this, you're going to be wrapped up like a Q-tip, basically. And the reason why you're wrapped up is twofold. Number one, a lot of surgeons use compression external compression with the wrapping to hold the skin down against the tissues after they've been lifted. Because remember, a facelift, by definition, you're lifting the skin away from the deep, soft tissues, and then you're relying on some type of compression to hold everything down so that fluid doesn't get built under there. The tissues can kind of adhere to the deeper structure, the skin can adhere, so that compression is necessary. Now, in our practice, we actually do something slightly different. We use external compression sutures that literally sew the skin down to the deeper structure. I've been doing this for several years, and what I found is that it really decreases the swelling, it decreases the potential for hematoma and seroma, all the things, all the fluid basically that can collect underneath the skin, and really makes the initial healing process go a little bit faster. Now, some surgeons will use compression from a wrapping. That is also valuable, but then sometimes you have to use that compression for like 3 or 4 days, and that can become very uncomfortable for people to do that. So when you see, in our case, our patient coming out with a big wrapping, in our case, we're using it mostly to soak up any, minor oozing or any of that kind of stuff that could be captured, and so it doesn't get on your pillows, etc. So that's why you look like a Q-tip. Then you go home, and typically the tissue is very numb. So there's not a lot of pain involved in the first night or so, because at the end of the day, not only have as you lift up the skin, a lot of those little nerves have been severed as part of the lifting approach, and therefore when they come back down, they're numb. So there's not a lot of discomfort after the procedure, especially right after, because there's also local anesthesia into the tissues. But then the local anesthesia wears off, and depending on the circumstances, some people have some discomfort, but it's mostly discomfort related to pressure and kind of like a discomfort from like a dullness. It's not like sharp pain, because again, those nerves that have been cut actually is a blessing in the sense that you're going to be numb for a few months after surgery, but the fact that you're not having any kind of sharp pain after surgery is a real bonus. Most of our patients literally only take Tylenol after surgery. They're not taking narcotics or taking heavy medicine. One other thing I want to point out is if you're getting this done, you cannot take ibuprofen, Advil, that type of stuff after surgery, because you increase your risk of bleeding, aspirin, and those type of things. So the only thing you can really take is basically Tylenol or narcotic pain medicine, which generally speaking we discourage because it's not necessary. So you go through the first night. Now, you're gonna be potentially nauseous if you have had general anesthesia. Most of our patients don't have nausea because they're having it under IV sedation, but you might. So you're gonna be aware of taking Zofran or some other type of medicine to help you be comfortable and not feeling nauseous. Then the next day comes. Next day, in most practices, including ours, we want to see the patient in the office. We want to see the patient in the office for 2 reasons. One is we want to clean the incisions and make sure that there's no dry blood on there, etc. It's just a cleansing, but more importantly, just to check in and see how everything's looking, if there's no fluid collections, no issues, etc. Now, depending on the type of facelift you're going to have done, you may have a drain placed or not. About 50% of our vertical restore patients get drains. The drains, they're a little cumbersome, they're a little unsightly looking, but they're not the end of the world. They do serve a very important purpose. They pull away any fluid so it doesn't sit underneath the skin. So that drain typically will stay anywhere from 1 to 4 days. In our practice, we typically just leave it in for 4 days to make sure we get all the fluid out of there and we don't have any issues with that. So now you go home, you rest and recover, and basically go on like a lazy teenager type of a lifestyle. You're going to be sitting up most of the time. We prefer patients not to lay down because laying down means more blood to the head, more swelling. Sitting up is great because everything kind of flows down. But here's where it gets interesting. Between days 1 and 4, what happens is that the tissues become more swollen because they go through a process that any surgical site or any surgical situation goes through, which is called third spacing. The tissues become leaky, and the fluid enters this the area that has been operated on, and the swelling begins to expand. So between day 1 and day 4, the swelling is actually increasing day at a time. One day at a time, you're actually, instead of getting better, you're actually getting more swollen. And the swelling is, again, at the end of the day, just a natural part of healing. You have to go through that. So when patients start to see their swelling increasing, as you can see here, as we go from day 1 to day 2, day 3, and day 4, you start to see there's, subtle but increased swelling. Is definitely not getting better. And this is usually where people start to kind of freak out. They're kind of like, hey, what in the world is going on? Why am I not getting better? I look so weird and distorted. The emotions run very, very high, usually around day 3 to 5. This is where the patient starts to wear, because normally you expect to get better as each day goes by, but instead you're getting worse. This is so important to remember. I want you to dial this one in so you know this one, because if not, this is where every part of you starts to doubt the logic and decision that you have made for yourself. Like, what in the world did I do to myself? Why did I go through this? Why did I choose to have this procedure? Even though we spent a lot of time educating our patients, and our patients have followed us on social and seen literally hundreds and hundreds of before and afters, and I do a really deliberate job of showing these before and after stages, still doubt creeps in. What if I'm the 1%? What if I'm the exception, etc.? So this is where a lot of support with your surgical team really becomes important. This is where that relationship with your care team becomes important, because that reassurance and that hand-holding is imperative at this time. Also, you want to have a really solid home environment. Whoever's been traveling with you and take care of you, they have to be on the same page. I've seen husbands sometimes freak out during this stage and really kind of make the wife feel worse about what they're going through. Like, they also are worried, and they let it out on the wife, like, what did you do, etc. Which you can imagine how painful emotionally that could be for somebody who's going through it. But a strong support is positive. Trust the process, just help you get through it. And really important, stay away from mirrors. It's a big advice I can give you. Try not to look at yourself, because you're going to change every day. You're not going to know what you're going to finally look like. Why bother? Why get stressed out? Just let it go. So as you can see here, as we're going through the transitions, peak swelling day 4 and 5. Now, that process of third spacing is starting to resolve. And what you're going to start to do is the swelling is going to start to come down. I always liken it to kind of like you're climbing a hill, you hit a plateau right around day 4 or 5, and then starting on day 6, like clockwork, at least in our practice, like clockwork, day 6 looks significantly better than day 5. And then day 7 looks significantly better than day 6. And from here, it's gonna go very quickly. And you fast forward, and then this is where like healing really starts taking off between day 7 and 14. People start healing very, very quickly after that. And that's usually why, when we advise people, how long should you take off of work and like important social stuff, not super important social stuff, but important enough to where you can't be scary looking. We typically say 2 weeks is what you need. And that's the bell shape. That's the majority of the people take about 2 weeks to recover. Again, most of our patients, as you can see, they don't have a lot of bruising. They don't have a lot going on outside of the normal kind of swelling. So as I'm saying this stuff to you, take it a little bit with a grain of salt, in the sense that another surgeon's timeline might be slightly different. The bruising might be slightly different, etc. But the things that happen during the first 7 days are true no matter what. This is what's going on. And then in our practice, again, we take out the drains on day 4. We take out our compression sutures anywhere from day 1 to 4, and we'll just sort of support and let the patient kind of get through the bulk of the healing. And then after that point of time, things get significantly easier. Most of our patients who travel in for surgery, in our practice, I'd say about 80% of our patients travel for surgery. They usually get back on a flight anywhere from like day 7 to day 10. They get back on the flight no matter where they're coming from and fly back. And then that's it. And then you're just, doing more of the same in terms of resting and relaxing the second week. But you see the light at the end of the tunnel, and it feels really good. And you by the time you get to 2 weeks and 3 weeks, so you're getting pretty excited about where this is all going. So guys, take all this with you. No matter who you're having a facelift done with, a lot of this stuff really, really does apply in general. And it's very helpful to know this. And I'm so grateful, beyond grateful, to all of our patients who've literally allowed us to share these intimate stages of their own recovery with all of you, with our community on social and YouTube and Instagram, etc. Because I can't tell you how much it's helped our surgical patients get clarity and comfort, and as they're going through it. And so many of our patients have literally gone back and like watched video after video, seen photo after photo, so they can really okay, this looks normal. This looks like it's how it should be. A couple caveats. Do not hesitate to contact your surgeon, your provider team, because if you think something is going awry, like, if there's a complication, for example, like a hematoma, usually happens in the first 24 hours. Our quilting sutures kind of like essentially eliminates that from being a possibility because they're putting external compression on. The head dressing doesn't really prevent that from happening so much. But if you notice there's swelling happening on one side of the face or the neck or whatever, you gotta call immediately. If you notice, redness or pain or, increased swelling happening related to possible infection, let your provider know. You gotta let the team know so they can immediately treat you. This is really, really important. So you gotta have that open line of communication. You gotta have access and availability. That first week is critical because most of the things if they're gonna go wrong, are gonna go wrong in the first week. And after that, the chances of things kind of heading south are very, very low. So you need a lot of support and a lot of attention in that first week. All right, everyone. I hope that that helped bring some clarity and some insight into the healing process in the first 7 days after a facelift or a vertical restore. If you have any questions, drop them in the comments below. Share this with any of your friends and family who may be endeavoring into this or just might find it interesting. And if you haven't already, make sure you hit like and follow or subscribe to this channel to get more content like this. I put out stuff every single week to help educate and enlighten and make the process of facial rejuvenation easier for you all. Thanks so much, Dr. Amir Karam.